My name is Karen Wolfe, and I will be your host for this edition of Politically Speaking. This is a Rogers TV program that engages our community leaders around issues that are important and matter to you. As we find ourselves emerging from the restrictions of one of the worst medical emergencies that any of us can remember, hopefully we can go forward and take some lessons learned with us, as well as some hope for a better future. This renewed focus or single focus on health over the last couple of years has promoted us to invite the new York Region Medical Officer of Health to join us and talk about his vision for the future and perhaps Georgina's role into it. So right now, I'd like to welcome the Medical Officer of Health for York Region, Dr. Barry Pakes. Dr. Pakes, thank you so much for being with us.
Thank you for having me.
Okay, so this is a fairly new post for you. I think you came into it in November 2021. So I wonder if we could take a few minutes and talk a little bit about your background.
Sure. I'm a public health and preventive medicine specialist, and that's a type of physician most people were not familiar with before the pandemic, although we've had many pandemics, actually not as big as this one that we've dealt with recently in the past, say, 10 to 20 years. But I have been, until my recent post, the program director, and still am, at the University of Toronto. So training medical officers of health and public health and preventive medicine specialists, and taken on a variety of roles with some of the graduates of my program. And our graduates include people like Lawrence Lowe, Eileen Davila, and many others. I've been Associate Medical Officer of Health in London, in Halton region, in Peel during the initial phase of the pandemic, was Deputy Chief Medical Officer in Nunavut. So that's where I'm coming from an academic perspective, a practice perspective. And I do practice clinically in urgent care, actually in Innisfil, not too far from Georgina, although the other side of the lake. And do a lot of global health work as well. So I run a global health training program. So come from a number of different angles. And I felt, it was the time during the pandemic, and with Dr. Kurji retiring, it was a great opportunity to take more of a leadership role in the pandemic and in public health in general, with that view to emerging from the pandemic into a new landscape and, so much work to do in public health.
Yeah, I looked at your resume. It's very impressive. And so is the title, Medical Officer of Health. Now, maybe you can tell us a little bit about what that means. What do you do on a regular basis? What responsibilities do you have with that title?
Sure. So, there's a lot there, many different things that we do. So, a medical officer of health in Ontario, and this differs, across the country and very much globally. But what we do in Ontario is the medical officer of health lead the 34 health units in Ontario, and we have associate medical officers of health who are physicians with similar training who help us out depending on the size of the health region, different numbers, and we run the programs and essentially take care, just as a clinical physician takes care of individuals. Medical officers of health do our best to take care of populations. So promote the health of populations, prevent illness in populations, with a focus on health promotion, the environment, and certainly, pandemic response, things that involve entire populations at once. And it's really a different frame of mind. And as someone, as I mentioned, who is involved in training medical officers of health, we really try to take that population perspective, both to act and intervene in many different ways, but also to assess the health of the population and understand where those population health needs are. And as we emerge from the pandemic, that's going to be our first order of business.
Terrific. Okay, so before we get into the nitty-gritty of the programs that you fund, I'd like to look at the budget of those health services. And I'm just wondering if you can tell me what the budget to deliver the health services were, say, in 2021, and what your budget is for 2022 as well.
Right. So, the budget of public health, and it's public health services, not health services. And I think that's an important distinction, especially in Canada, where health care is funded through the public purse, making that distinction between publicly funded health care, which is, on an individual basis, versus public health and public health services, which certainly we do provide services to individuals, but with a view to the entire population. But with respect to your question, the funding of public health is a really challenging one to tease apart, because we are a municipally, or in our case in York Region, a regionally nested, we'll call it, organization. So we're within York Region, and we are somewhat unique because many health units across the province are independent organizations, some part of municipalities, and we're part of a region. The budget overall, we'll start with overall in Ontario, 98%-ish goes towards health care, and only about 1.5% to 2% goes to public health. So the idea that prevention, an ounce of prevention is worth a pound of cure, we're only spending 2% of our budget on prevention. But with respect to public health and our budget, again, it's hard to put it together because some of it comes municipally, a lot of it comes from the provincial government, but it's in the order of $40 to $50 million in York Region, and in this past year about $130 million, or the budget for 2022 rather, and that takes into account a lot of the work we're doing in previously about 120 in 2021, 130 in 2022. And the idea there is continuing to fund the public health activities related to COVID, and then continuing our important public health work in other areas and actually doing a lot of that catch-up work. So, those numbers aren't reflective of what we do generally because they come from so many different pockets, and a lot of what we're doing, in fact, of course, 2020 and 2021, a lion's share of what we were doing was around the pandemic, and we're looking forward as much as everyone else is to transitioning out of that.
Okay, so maybe you can tell us then, with that kind of a budget, how would you measure the performance and the effectiveness then of the programming that your portfolio delivers? What are your key performance indicators that come with your plans?
So, what we focus on more generally in public health, and I'll get to York Region Public Health in a moment, is population well-being and population health. And one of the hallmarks of public health as opposed to clinical medicine is it is about prevention and not entirely about treatment. And so it is challenging to measure sometimes because the things that we prevent, all the deaths that we've prevented, whether it's COVID or opioid overdose or cardiovascular disease and cancer, which are obviously much more significant generally, if we prevent those deaths, those don't get measured, right? We have ways of measuring them, certainly, usually using epidemiology and biostatistics, which are, big parts of what we do, but they're often harder metrics to establish. Some of the things that are easy to measure are, the number of vaccines we delivered, not just COVID, but in our grade 7 programs, human papillomavirus, HPV, hepatitis B, meningococcal, all of the follow-up we do, in terms of we've got sexual health clinics, we've got child and family services, which is a huge part of what we do. We have a provincially funded dental program as well, and a whole set of health protection activities. So when it comes to personal service settings like tattoo parlors, massage parlors, restaurants, inspections, pools, all of that is within our portfolios. So many things that we do. And, and as part of each one of those, there's a whole communication piece, there's a data gathering piece, and then there's the service delivery piece. So, it's quite comprehensive. And we're always assessing and evaluating what we're doing to bring the greatest value to the population in the most effective and efficient way possible, but also looking to new things. And that's something we're going to be doing after the pandemic with all of the mental health impacts that we've been seeing. And there isn't anyone else that's going to be doing the work that we're doing in figuring out what are those short, medium, and long-term impacts at the population level. We know on the individual level because we've heard stories, certainly, and we have family members and others who've either experienced COVID or experienced the hardships related to it. But figuring out what that means and how to intervene to make lives better for people, that's really what we're all about.
Okay. Well, I want to take a look at York Region's COVID statistics, because as you were saying, you spend a lot of time actually managing that pandemic here in York Region. So let's look at hospitalization, ICUs, deaths, vaccinations. And right off the top, what was the percentage of the population that was vaccinated in York Region? And I think, we could probably include 1 dose, 2 dose, and 3 doses. So what the total population, I guess, was.
Sure. So we did very well compared to the rest of the province, sort of at the top of the pack. I would say, and there's a variety of reasons for that I can go into. But our overall first dose vaccination rate above age 12 was almost 90%, around 88%, which is absolutely terrific, and we're really excited about. The metrics we're tracking most importantly right now are in the 5 to 11 group. And in that group, we are doing well as well in York Region, with about 60% with first dose, and about half of those kids have had their second dose, and increasing all the time. I think it's worthwhile to say that with respect to Georgina, we're not doing as well. And we can talk about some of the reasons for that, but we're only around the 44-45% coverage in Georgina in the 5 to 11 group. And really importantly, in the 12 to 17 group, where we did really well across the province, but especially in York Region, with over 90% with their first dose. In Georgina, we had about 68, almost 70%. So, there's some remarkable differences there. And one of the things we try to do in public health that I haven't mentioned yet is we have a huge focus on health equity. And so where we see these disparities, like those in vaccination rates, we really do our best to make sure to even things out, to make an even playing field, and making sure there's access to vaccine, particularly in Georgina, at Georgina Ice Palace, but also with a number of pop-up clinics, school clinics, and a variety of other methods. That's something we really care deeply about and really have been focusing on.
Yeah, I'm actually surprised to hear that those numbers are so low for Georgina. But, what efforts were taken to get to, the 90% that you have? Why do you think, it was so much greater, the take was so much greater in south of Georgina than in our area?
So, that's something we're still trying to tease out. Certainly, one of the reasons behind the difference, for example, in the 5 to 11 group and the 12 to 17 group, of course, is that the proof of vaccination applied to 12 and up, but didn't apply to the 5 to 11 for a variety of reasons, including that the 5 to 11 wasn't actually authorized until quite a bit later. The numbers that we got out of that, people who are, maybe a little bit hesitant, but really did have to move forward. They wanted their kids to be engaged in all kinds of activities, so they had to get them vaccinated. But in Georgina, a little bit less. That was the case, a little bit less. There are demographic reasons in terms of generally in the province of Ontario, more rural areas have a little bit lower vaccination rates, depending on income levels, political preferences. There's a whole host of reasons. And one of the things we've done to try to figure that out, and we're really still in the process of that, is we've got a survey that went out to parents of 5 to 11-year-olds, and we've got over 15,000 responses, and we're analyzing that data. And what we did with that was create a webinar that just happened earlier this week that focused on some of those questions, those issues that parents had, and we provided some answers to them, and making sure we had access. So, in Georgina, about 50,000 people, we had Georgina Ice Palace with a lot of access, both appointments and walk-in, and 7 days a week. We're moving that down to 4 days a week shortly, because we want to maximize the amount of use of that facility as well as our staff resources. But, making sure we had access and going to the places where people are. Like I said, those pop-ups and school-based clinics, those didn't occur in the rest of York Region. We made the extra effort to do that in Georgina.
Okay, so I read that there was around 911 deaths associated to COVID. How many in Georgina?
I'm not sure the exact numbers in Georgina. We often don't break them down. I can get those numbers for you, but I can definitely tell you that our York Region numbers and in each one of our municipalities weren't significantly different than those across Ontario, or at least, and certainly in the GTA.
There were various announcements coming out of Queen's Park on how to manage this pandemic, and I'm just wondering, if you agreed with a lot of the restrictions. Did they go far enough, or were there not enough? Now, that's a question that we're going to have to hold until our next segment. Please don't go too far away. We'll be right back with Dr. Pakes. Thank you for being with us. We're here with Dr. Barry Pakes. He's the Medical Officer of Health for York Region, and we're talking about a host of things, actually, and bringing his vision into the public health discussion and Georgina's role in there. So the question that we had just before break, Dr. Pakes, was the various announcements that came out of Queen's Park, and I just wondered whether you agreed with any of them, with most of them, or were there some you didn't agree with? Do you think there were too many? Do you think there were not enough? What's your take on what came out of Queen's Park to help manage this pandemic?
So, it's been a long 2 years. And so, a general, question about the timing and certain aspects of the pandemic, and restrictions and public health measures. I can certainly speak to a number of them individually. I think overall we did very well. There's no doubt that at certain times I would have wished we'd have done things a little bit differently, or acted a little bit sooner, or take away things a little bit later, or frame things even a little bit differently. But I think overall, and we can just see by our numbers, we have done very well, not only compared to other jurisdictions globally, but within the province of Ontario, York Region has done very well. And within Canada, Ontario has done very well. Other provinces removed mask mandates or allowed gathering or various interventions a little bit earlier. We watched what they did just as just this week. Quebec is taking off masks in schools. Maybe reasonable for Quebec, a little bit different demographics. We're going to wait a little bit longer. And I think that's a very wise move. When we certainly have looked around the world and across Canada, we have done generally very well. So, there are some specific things we could have done a little bit differently, but the big picture, as difficult as it most certainly has been for everyone, as someone who's very interested and involved and still involved in global health and in global health ethics. I did, some work at the World Health Organization on exactly this kind of response about 15 years ago. I think we've done well, so we can be proud of that. And I think we're going to continue to do well. We have, Dr. Moore and the cabinet provincially as well, a thoughtful group of people, and we have the Ontario Science Table informing us. And I think overall we're in a good trajectory and have been in a good place, as challenging as it's been.
Okay, so to date, we talked a little bit about the response to COVID in York Region, but to date, how much do you think we've spent managing this pandemic in York Region?
Ooh, that's a difficult one because, there are direct costs and indirect costs. I know, in terms of vaccination, it's in the order of $30 to $40 million. But it's just testing. And again, testing itself is not within the purview of local public health. That's, the ministry and Public Health Ontario labs. There are many, many billions of dollars that have been spent. I know generally about half the provincial budget is spent on health. And I believe, if I'm not mistaken, the most recent provincially has it about $8 to $10 billion. But it's only going to be after a lot of consideration what we include, what we don't include. Because of course, one of the most important interventions has been the support to businesses. That's of course not part of public health or health care, but that is a health intervention and a public health intervention. When we support workers not to come to work. This was a while ago, and I was working in the workplace outbreaks in Peel Region. When we support workers to not attend work when they're ill, that is an incredibly important public health intervention. Costs a lot of money, but prevents a lot of illness and death. And, those things, how we actually count that is really very challenging. There's no doubt this is the most expensive thing and most catastrophic thing that's happened in Ontario and the world in modern times, and it's going to be a long time before we completely, have an accounting of it. I don't think money has been squandered or wasted in any way, shape, or form. And when we respond to emergencies, and that's natural disasters, war, or public health emergencies. And there's similarities between those things. There's the consensus in sort of modern Western states and really everywhere that it's sometimes better to spend a little bit more and save lives rather than, penny pinching and risking things. We can't do that overall. And we've been very wise, I think, in York Region and provincially about how we've spent money. But it's a very difficult question that will require a lot of thought and reflection after the pandemic.
I'm sure. So, if we're coming out of the worst of this and we resign ourselves to the fact that we have to live with it, something like the common cold, what recommendation would you make to ensure that we're better prepared next time? Because we did get caught at the very beginning with some issues.
Well, so what we learn from COVID, it's very challenging because we have had previous pandemics. We had SARS in Ontario and a number of very important reports. And in fact, in March 2020, right at the beginning of the pandemic, a number of us went back and looked at those reports, and we do actually look at them fairly often because we also had Zika, Ebola, H1N1, weren't population level like this in any way, but lots of lessons learned from there too. And those lessons we learned from SARS, we implemented some of them, but let it slide a little bit by 15 years later. And so many
better.
Pardon me?
What would we do better this time?
Oh, I mean, keep our preparedness, where it was. So what we did at a provincial level specifically just before the pandemic, if you'll recall, was cut public health funding by almost 30%. So that created an incredible amount of stress and a lack of preparedness. That additional piece of preparedness was not there in local Public Health Ontario more broadly. And that significantly impacted our ability to respond initially. And of course, in Ontario, we don't have a healthcare system, right? We have all of the elements of the healthcare system are funded provincially, but they're not connected in a systematic way as they are in other provinces or in many other parts of the world. In other words, family doctors, hospitals, specialists, labs, pharmacies, they're all funded in many ways, or for the most part by the Ministry of Health, but they're not connected in a governance structure. And that may seem irrelevant to most people because they care about the services they receive. But when you have a system that's connected meaningfully, then you can seamlessly communicate with each other. You don't work at cross purposes, and we have a challenge with that from information technology perspective, or even just opening assessment centers. So you had some assessment centers that were in hospitals. You had others run by community health centers. Others run in emergency departments. Other countries, other jurisdictions were able to do it differently. We have great people working in the healthcare system, and including in the Ministry of Health and the Chief Medical Officer's office, that managed to work around that. And we had great outcomes despite that. But certainly the seamlessness of it would have been much better off the bat, had we had that system.
That's a great observation, actually. So I want to actually close our discussion around the pandemic and move on to other public health issues and priorities. And I'm just wondering, if we take a look at these other priorities, which ones would you isolate as key priorities going forward? And we're going to not include COVID in that.
Sure. So, that's one of the first priorities certainly is doing a proper population health assessment to understand what those priorities are. So, there's two kinds of challenges that we can have, ones we know about and ones we don't know about. So we're going to have to address both of those at the same time. We're going to have to figure out the ones we don't know about, and the ones we do know about are certainly doing a lot of the catch up that is part of our normal work. So, whether it comes to, restaurant or personal service setting inspections, the vaccine programs that I mentioned for grade 7s and catch up, some of the work a lot of work has continued, certainly with vulnerable, marginalized populations, breastfeeding help to new parents, some of the work we're doing around outreach, some of the work we're doing around health equity, and particularly a little bit less so in York Region, but only marginally so, the opioid crisis, which is something across the country and across Ontario, which is very, very significant, is something we need to better understand. And that crisis has only worsened significantly throughout the pandemic. So we need better tools to be able to assess that as well. So, those are all priorities, but again, the number one priority is doing that population health assessment, figuring that out, recouping and doing the things we know we need to do and catch up that are very time sensitive, and then moving to those other elements.
Okay, so on that line, we've heard that York Region is going to offer some public health programs, some new ones actually, at the link in Sutton. And I want to take a few minutes to go over some of the clinics and programs. And I want to start with the clinics. So one of the first clinics that I see should be coming here soon, and maybe you can tell us a little bit about each one, not a lot, just a little bit about each one, and when you think that clinic will be up and running at the link. So the first one I want to talk about is children's dental screening. Now, my information is that there is a dental screening at the schools. How does this particular clinic complement what goes on in the schools, or does it?
So, there are various different ways, and it's interesting to begin with why dental services is within public health. And, it makes sense because it's preventive. And we have a number of clinics that are going to be coming into the link. And I've only seen it online, and I look forward to visiting it in person, but it looks like a great facility. The children's dental screening, the Ontario Seniors Dental Program, breastfeeding clinics, sexual health clinics. The sexual health clinics are open right now. But I think some of our plans, and this goes back to your previous question with respect to how our in-person services are going to work and when exactly they're going to be opening, is something that's a little bit flexible right now. And in fact, right after our interview right now, I'm meeting with the manager who's actually in charge, or the director rather, of those services to talk about that. And one of the things we're doing right now is, and we have to redo this almost every week based on what's going on with COVID, is reassess our movement from emergency operations into our regular operations. So, unfortunately, some of those, very specific details I don't have for you right now because we're still a bit in flux, but those services are most certainly coming. And I can assure you that they're going to be coming as quickly as we can deliver them in person.
Okay, so what can a resident expect going into one of these clinics? I mean, it's information. They're going to be provided with some information, told where they can go to actually be treated, or there's no treatments at these clinics, is there?
Well, the Ontario Senior Dental Care Program will involve, that's, dental treatments, certainly. The dental screening is the programs, as you mentioned, that go on in schools and are going to go on at the link as well, which is, screening is where you, take a look for issues and then pass them on. And of course, there's Healthy Smiles Ontario. There is, free dental services for children. And that's usually the way that the dental screening works, whether it's in schools or in a clinic like at the link. And so that will, as seamlessly as we can. And that's always something working with our partners that we do.
The Seniors Dental Program?
The Seniors Dental Program that's going to be happening at the link, but also the children's screening, seamlessly getting kids from being screened to making sure that they're treated. And then, to make sure that whatever issues have arisen, we prevent them going forward.
And for the seniors, that's the same idea. They're going to be screening.
No, the screening, the Seniors Dental Program, my understanding is that's actually a dental program, not only a screening program. And there's various elements to that we can share, and parts of that are on our website and coming this year. That's unfortunately the only detail that I can offer now, just because of some of the challenges we're having with the pandemic.
Yep. And breastfeeding, same idea with that?
Yes, same idea with that. And breastfeeding is one of those interesting issues. And as a clinician, I deal with this as well, that public health nurses are terrific at helping parents, new parents rather, with breastfeeding, but also not only with breastfeeding. That's the unique approach or the advantage of public health, is that we have, especially in York Region, social services, housing services, all kind of other outreach that we can link people to when we identify those issues with new parents. And having 5 children myself, I know, and both of us being physicians, I know that those issues can arise no matter where you're coming from. Yeah. And so, that's really valuable. And that's a real value add that we bring to new parents.
Okay, we're going to have to take a break, and I would ask you to stay with us. We'll be right back with Dr. Pakes. Welcome back. My name is Karen Wolfe, and I'm here with York Region's new Medical Officer of Health, Dr. Barry Pakes, and we're talking about public health services in Georgina and certainly York Region. So at the break, or just before the break, we were talking about some of the clinics actually that are going to come into Sutton at the link. And right now I want to talk about a couple of the new programs that are going to be there as well. Now, one that I saw said Ontario Works. I'm thinking that's probably not part of your portfolio or your purview.
No. So, I mean, it is part of, or many ways interdigitates with York Region. And that's one of the unique things about York Region Public Health. We're part of the region, but no, that's not specifically. Some other things, though, that are coming is one of the things I mentioned is our health protection branch, which is, incredibly important work. And one of the things they do is well water testing. So that, there'll be a drop-off point at the link. And really, that's just a start to the sorts of things that we'll be able to either offer or a hub for information at that link site.
Now, the other one that I found extremely interesting going in there is the harm reduction program and supplies. Maybe you can explain exactly what that is, because when you look at the title, you really don't know what that means. So maybe you can tell us.
Sure. So, harm reduction services, or the idea, we'll start with the idea of harm reduction, which is really focusing on activities, things that people are doing, and oftentimes we're talking about substance use, but not always, that are potentially harmful for people. But in the past, our approach was, stop doing that. Not our approach in public health, but often in society. And our approach in public health is we help people reduce the harms of those activities without demanding or asking people to stop doing those activities, because there are often a variety of reasons why they're engaged with that. So one of the things we do, and this is something very accepted in public health circles and has been very effective, is we give people clean needles and clean supplies if they're injection drug users. And the reason for that is it prevents hepatitis A, hepatitis B, hepatitis C, and HIV. And at the same time as we're providing those services and those materials, we engage people in conversations and build trusting relationships, whether they be through those services or our outreach workers, and then connect people to services that can help them better deal with those substance use issues. Many health units around Ontario, around the world, and Canada have engaged in harm reduction approaches that involve settings in which people can use their drugs, and even providing those drugs sometimes. We don't have those in York Region, but those are things that are part of the harm reduction portfolio. The harm reduction services that are proposed at the link are going to be the sort of the needle exchange or pipes, that sort of thing, that are going to be really valuable. And really, as I started with, one of the things we are most certainly always do, but going to be doing again after the pandemic, is reassessing the need for some of these services in Georgina and elsewhere, and really working hard to meet those needs. And sometimes that is through something like the link. Other times it's through mobile services that go to where people are, and to reduce the harms that way. And so, there are a variety of approaches, and our goal there is to meet the needs of individuals who are in those circumstances. And overall, what that does is improve population health while we're improving the health of those individuals.
Okay, so there's no plans to, expand it into an addiction treatment type facility either, where they could go, every week or something, sit down in a group setting and talk about trying to get clean.
So, well, there are many, different approaches. There could certainly be, the link being a community hub. That's certainly not off the table. That's not something I believe that is planned right now. But, usually from the public health perspective, we offer both preventive services, less commonly treatment services, but certainly, groups and outreach and facilitating that kind of engagement is something we can certainly look at doing. And one of the most important things we do is have partner organizations that can deliver those. So we engage people and link them up to the services that they need, whether that means improving their health through, making sure their substance use is less harmful, or a variety of other things. And that includes, tobacco. And I didn't mention one of our big areas, of course, is tobacco use, which still, other than COVID, is one of the leading killers globally. And still, in Ontario, even though a smaller proportion of people use that, and of course, alcohol, many other things, substances, and those are programs we certainly have, and you'll continue to offer in a variety of different ways.
Yeah, when I looked at the programs that are coming to the link, with the restrictions and the length of time that we've been in this pandemic, it's really brought to light the struggles that people are having with mental illness. And I'm just wondering if there's programs in York Region that deal specifically with mental illness. And, isn't that something that could be brought to the link? I see that as a missing link of public health.
Yeah, so we certainly are very interested in mental health and mental health at a population level, and certainly throughout the pandemic, people have often said, "Oh, we're only caring about COVID and not about mental health," and that could not be more untrue. And mental health of the individuals and of the public is of utmost concern, and ways that we can address, understand the mental health of individuals and populations and address some of those issues is critically important to us. One of the most acute things certainly is the opioid crisis, but that's the very tip of the iceberg. And you're absolutely right that there's a lot going on behind the scenes. And as we emerge from the pandemic, that is going to be more obvious. And we're most certainly going to work to address those. And in various parts of our local public health unit, we do have elements that address mental health. And not only that, but within the region more generally, when in community and health services, social services, housing, is a critical piece of mental health. Because, in many ways, a lot of the health harms and the mental health harms that occur with individuals has to do with housing. And that's very much related to substance use as well. So those are things we're definitely looking at. With this, the reduction of in-person services, everyone, no matter what field you're in, medical or otherwise, are trying to figure out how we can offer our services in a most appropriate way for people. Some of that's in person, some of it's not, and some of it's in a variety of other ways. And so we're going to continue to look at that. And right now is the time when we're transitioning, when we're assessing, and hopefully going to be announcing our intention and developing those programs over the next 6 months to a year.
Oh, okay, good. I'm just wondering, we talked about some of the new programs and clinics that might come into the link within the next little while. But there are other public health services in Georgina besides those. Maybe you can tell us a little bit about some of the others, maybe that are in Keswick or some of the other areas here in Georgina.
Sure. A lot of what we do, and this is the key thing about public health, is when we're successful at what we do, nobody knows about us, right? And so, keeping the water safe, keeping personal services settings safe, pools, testing the, Lake Simcoe, certainly. And just to say, actually, I should have mentioned at the beginning that my parents have had a place on and I've been grew up in many ways on the other side of Lake Simcoe, but looking at Georgina for quite some time, and just recently did a charity bike ride from Balfour Beach up north there. So, familiar with the area, and that piece in the background, the health protection services, a huge part of what we do, and sexual health services as well in various ways. And what we're going to be doing increasingly, and what one of the things that the silver linings of the pandemic is being more engaged with primary care providers, as well as hospitals, not in Georgina particularly, but in York Region and South Lake Hospital, which many people in Georgina certainly access, and building on those relationships to make sure there's more comprehensive approach to both health services and public health services for residents in Georgina.
Yeah, now that's a great segue actually to my next question. Georgina has a population of close to 50,000 people, and the Healthcare Council here would argue that there is a shortage of doctors in Georgina and that we are underserviced when it comes to patient care. So does your team provide financial support to help fund programs to bring doctors into communities York Region communities that do have shortages like us?
So health services, in other words, doctors, is right, not in our purview at all. That's very separate than public health. So clinical services, doctor services or nurse of any kind are not within our purview. Certainly, building those relationships with existing primary care providers is one of the things we do, but funding clinical care isn't at all within our purview. That's the Ministry of Health through a totally different area. But I most certainly agree. And as I mentioned, as a clinician who works in Innisfil, almost everybody I see does not have a family doctor. I don't even have a family doctor. And many people in Ontario don't. It is a significant crisis. And we need to figure out, it's not just about it getting individual doctors. As I mentioned earlier, it is about having a system. Ontario Health Teams is one approach to it, but it's not necessarily as comprehensive approach as I think we need. So there's no question it's an issue. And one of the things that happens is when people don't have primary care providers or others, public health services sometimes, has to fill in for that, or, some of our screening services or assessment services find that that's the case, and we can help advocate for that using some of our data. But specifically around funding clinical services or recruiting them, that's not within our purview. Although as an academic and a clinician, that is something I'm very interested in.
Well, certainly. And one of the reasons I asked that question is because Durham Region, which is next door to where I live, has just announced that they're going to give Beaverton $100,000 to help people there bring in a doctor because they too are underserviced. And so, that obviously the region has identified that this is an issue for public health, and they are going to pony up some money to help address that issue. And I just thought if your Durham Region can do it, perhaps, you can put a bug in the ear at York Region to get them to take a look at it as well. And then, like you said, your portfolio would not have to step in and make up some of the, issues that are being left undone because we are underserviced.
Mm-hmm. Yeah, absolutely. I wasn't aware of that. And I'm reasonably certain it's not coming on the public health side, but rather Durham Region and York Region could be something they'd consider. I think, as I'm sure you're aware, and all the those who are listening in here are aware, that kind of Band-Aid solution isn't a great solution. And as someone who works clinically in Northern Ontario as well, that is very underserved, particularly on holidays, and long weekends, that kind of thing. I know a lot of what it means to not have family doctors, or for communities not to have physicians, and the sustainability more broadly of that is incredibly important. I don't know that it's all about money, or it's 99% not about money. It's about, a sustainable system. But you're right that that approach can sometimes help, and that, it's interesting to hear that Durham Region is doing that.
Sure. So if someone gets ill after the doctor's offices close here in Georgina at 5:00 and on weekends, and someone gets sick, their only option is to go to the emergency departments at a hospital. And I'm just wondering what your thoughts are about providing 24-hour, 7-day-a-week emergency care to residents in Georgina. I know, like you're saying, clinical medicine is not your responsibility as a public health official, but I'm just wondering what your thoughts are around that.
Well, the health of the population, is my concern and responsibility. So I definitely do care about it. It's just not formally part of York Region Public Health, but something I am absolutely interested in. And there's no question that is a gap. It's a gap in many places, including in Georgina, certainly. And advocating for that kind of thing is something we can most certainly do. And looking at the health metrics in the community in Georgina and using those to advocate, absolutely something we can do, and a lot of with our partners as well. In my other roles as a program director at University of Toronto, very much engaged with the Department of Family and Community Medicine at the University of Toronto, which is the largest department of family medicine in the country, let alone in the world. I believe it is the largest in the world. And that's where we train family doctors, and making sure to engage them, understanding what the needs are in the community, and working with them to understand the population health perspective. Absolutely. And that's something I am very much working on.
Okay, we're going to have to take another break, Dr. Pakes. Please don't go too far away. We will be right back talking more about public health care here in Georgina and York Region. Welcome back. My name is Karen Wolfe, and I'm here with Dr. Barry Pakes, York Region's Medical Officer of Health, and we're talking about public health issues. We're talking about programming and clinics here in Georgina and in York Region. Now, just before the break, Dr. Pakes, we were talking about the idea of having a 24-hour, 7-day-a-week emergency care facility here in Georgina, and certainly we know that that's not part of your responsibility as medical officer of health. And you talked briefly about it, and I'm just wondering, is there an opportunity to work with the Health Council here, because that is part and parcel of what they're trying to do, and they could probably use your expertise in the discussions around that. So you talked a little bit about partners and partnerships, and maybe you could help them out a little bit with that whole issue.
Absolutely. And unfortunately, that's one of the parts of the pandemic that's been most challenging for me, certainly as a medical officer of health, only now 2.5, 3 months into my role, is that what I most want to do, and what any medical officer of health should do, is to engage with those partners right from the get-go. And because of the overwhelming pandemic, I haven't been able to do that. So that's a terrific suggestion. I'd be very happy to engage with them and to try to solve some of those issues that, again, are health care issues, but of very much interest to public health, because the health of the population, is what we're ultimately responsible for and interested in. So, absolutely. And I really do look forward to that. And that's one of the things I look forward most to, in addition to the pandemic being over, because that piece of work is somewhat overwhelming, and we want to get back to all the things we do in public health, but building those relationships is one of the most important elements. And I'm really looking forward to that as well.
Yeah, I mean, nobody expects that this is going to happen overnight. But certainly, if nothing else, it would take the pressure off the emergency department itself, like if we had that kind of emergency care here. Okay, so we'll move on to the future then. What major challenges do you see the healthcare sector facing within the next 5 to 10 years?
Sure. So, I mean, there's the healthcare sector and the public health sector. And again,
public health.
Yeah. And I could speak to both, to be honest. I'm more than happy to speak to both, but they are in Ontario very separate. And I think it's important to note that in other provinces, they are together. And there's some advantages to that, but a lot of disadvantages as well. So actually, people around the country actually look to Ontario and say, it's actually good that public health is a little bit separate, because we have a different perspective. But, a relationship is really important. But in the public health sector, I mean, one of the challenges we had before the pandemic was the significant budget cuts, this idea of consolidating many of the health units. We have 34 in Ontario, and there was a plan to decrease that to 14. And now Ontario Health exists that didn't exist before. And so one of the greatest challenges, or the challenges that are coming at us, all three of these challenges at the same time: one, continuing to deal with COVID; two, catching up on all the things we need to do and haven't been able to do, and assessing those new health needs of the population; and three, which is an unnecessary one that we would rather not have, is dealing with all the structural issues that sort of were present before COVID hit and may come back again after COVID. After SARS, many years ago in 2003, there was sort of this effort to get those lessons learned, restructure some public health, be better ready for emergencies in the future, and better provide public health and population services. And hopefully, post-COVID, that's going to happen in Ontario, Canada, and globally. So I'm looking forward to that. But there are some of those challenges in those three areas, and all three of them happening at the same time, and they're all quite big. So those are really what I'm looking at going forward. But I am optimistic that I think we're going to be able to meet those challenges, particularly in York Region. because of the regional structures we have, because of the size. We're 1.2 million people in York Region, 50,000 in Georgina, certainly, but we have this great rural, urban, suburban mix, and a lot of diversity in our region as well. And that puts us in a really good place. We're really right-sized, I think, in order to address some of these issues as part of the public health system. So I'm optimistic from that perspective.
Well, that's good. I think, a lot of the challenge is going to be funding, certainly because of all of the challenges that you've identified. A lot of times it's going to need funding to attack those. So what new plans and / procedures do you think need to be put in place to address these challenges?
So, the biggest picture piece is the structure of public health and how it's governed and the kind of work we do. And it's really challenging to be able to address that in the COVID and non-COVID pieces at the same time. So, we're always trying to think of that and to have a little piece of our minds focusing on the lessons learned, focusing on the strategic plan moving forward at the same time as dealing with these other issues. And that is still challenging, but again, I'm pretty optimistic that we'll be able to do it. I think, when it comes to funding in public health, certainly it's always a challenge. As I mentioned earlier, though, we're 1.5% to 2% of healthcare funding. So, in healthcare is around the $50 to $60 billion, and in public health is only $1 billion at most, or actually considerably less than that. So it is small fry, but huge return on investment. Yeah. And I think, reconvincing the public decision makers, politicians, of our value in public health at preventing future expenditures, preventing future further, illness in the population is far more cost efficient if we're just looking at money. But most importantly, it improves the quality of life for everybody. And that really is our focus.
Dr. Pakes, I really want to thank you for being with us, taking time out of your day to help us understand some of the public health services that are here for us.
Thank you. And I want to make sure that I end by thanking all of the people who are working at York Region Public Health and at York Region generally. Everything I described is not something that I have done by any means. It's this incredible team that we've got working at York Region Public Health. And I think everyone, including myself, needs to be incredibly thankful to them. And they are absolutely dedicated to continue this work in an amazing fashion. And really how we've managed the pandemic and our health overall and what we can look forward to is really thanks to them.
Thank you very much, and thank you for being with us.
Thank you.